Hello, everyone. My name is George Patient. I'm an ICU nurse at a trauma center at Bethesda, Maryland. We take trauma patients as well as um, general surgical ICU patients, as well as open heart cardiothoracic patients. The two provisions I chose really deals with being a patient advocate and being patient-centered. Provision 2, the nurse's primary commitment is to the patient, whether an individual, family, group, community, or population. Also, Provision 3, which I also think applies and is very similar, states the nurse promotes, advocates for, and protects the rights, health, and safety of the patient. So often we see our patients at uh, a very sick time in their life. Often they're not able to make their own decisions, worry family members, obviously. And so one case comes to mind with a particular patient. About a year ago, we had a lady who, about a 76-year-old female, came in with, um, she had an abscess tooth that became severely infected, brought to the ED, severe sepsis, which she coded downstairs. They intubated her, lined her, also uh, fluid resuscitation, and brought to the ICU. So in the ICU, she coded again, requiring um, three different vasopressors, Levophed, phenylephrine, and vasopressin. Um, she required high doses of these medications for a substantial period of time, enough so that eventually, throughout the course of her 2 months with us, lost the use of both feet, which were amputated. So uh, that's a kind of a little background of the patient itself. Now, how it applies with the nursing code um, and the ICU world that I work in is family members have sometimes, whether it be guilt about letting a loved one go, which is very understandable. They just can't make that decision. They're under a lot of stress as well. This particular patient had a son who was actually the power of attorney. With the patient being so sick and the increased downtime during her multiple codes, anoxic brain injury, her her chances of a meaningful, not only neurological recovery, but also just a good, decent quality of life was very bleak. So the son actually had kept her as a full code, very rude, belligerent, to the point where he had to have a behavioral contract with the hospital. He had a lot of complaints with a lot of the staff, especially the female staff, with not just only doctors, but respiratory therapists, nurses, and our nurse managers. So uh, we often face the dilemma of advocating for the patient itself and not the family members. Because, like I said, our patients usually aren't in the right state um, to actually make decisions for themselves, and their suffering is prolonged just because a family member can't make that decision. So the two provisions I spoke of earlier, Provision 2 and Provision 3, I feel directly is, if anything, a reminder that who we're actually treating, and that's our patients. Thank you.